Right?
I'm ready.
How are you feeling?
Uh, Not that great.
All right, so we're just going to have to try to get through some of these questions so I can get your information in our system. My name's Heather. I'm one of the counselors here.
How you doing? I'm Joe. It's
All
nice
right,
to
Joe.
meet you.
Nice to meet you too. Can you let me know what is bringing you into treatment?
Well, my drug addiction, it's just gotten way out of control. I'm to the point where I'm breaking laws and committing crimes and to get the money to get high. I don't have work. My family is done with me. My girlfriend left me. I'm at the end of my rope.
And are you drinking and using daily?
Yeah, absolutely. I'm extremely addicted to alcohol. It's to the point where I have to drink every couple hours or I get sick. Using crack cocaine every night. Yeah.
And then you're choosing to come into treatment on your own, or did somebody else kind of encourage you to come to treatment?
Well, I am. It is voluntarily, but I don't really have anywhere else to go. My mother kicked me out. We had a place. I had a place with my girlfriend, and we lost it. Yeah, so it's basically this, or I'm gonna be out on the streets or homeless.
Do you think that you're ready to get clean this time?
I feel like I am. Right now I don't feel the greatest, so it's hard to really get into it. But yeah, I think this is my last shot here.
And how old are you, Joseph?
I am 41.
And what do you identify as? He, him?
Him.
And are you, what's your sexual orientation? Are you straight?
I'm a straight male.
Okay. And I know that you said that you have been drinking daily. Are you going through any detox withdrawals right now? Or what are some of the detox withdrawals that you normally go through when you are not drinking on a regular basis?
I get extremely sick and fatigued. I can't sleep.
Do you get
I
shakes?
can throw up. I can get my stomach, my bowel movements. I get shakes, TTs, hallucinations, all that.
And then you also mentioned that you're smoking crack. Is that daily?
Yeah.
Okay. Is there any other substances that you're using right now?
Not really. Sometimes I smoke weed, or if there's pills around, I might eat them.
But mainly alcohol and
yeah,
coke, crack.
yeah.
Okay. And then, where were you born at?
In Baltimore City.
And both of your parents raised you?
They did. They divorced when I was 5. I saw my dad, I guess, every other weekend, and lived with my mom for a long time. And then later on in my teenage years, we went to live with my dad because my mom couldn't handle us anymore. We were crazy.
And who are we? Is that your siblings?
Yeah, me and my brother, Scott.
How many other siblings do you have?
I have three older brothers, but 2 of them, my closest one was Scott. He's the one that lived with me.
Okay. So now we're going to go over your history of drug use, can you let me know at what age you started to use any type of substances? Like, how old were you when you
God,
first?
this is gonna be a lot. The first time I ever drank alcohol, I was 6.
6 years old.
I stole my father's beer out of the trunk of his car and drank it with my brother.
Now, from 6 till, was there periods of time where you stopped drinking though? You don't have to
Yeah, I
go
wasn't-
too
I
much in
wasn't.
detail, but
That was just the first time.
okay, so 6 you started drinking. Okay, what's the next substance?
I started smoking weed when I was 10.
And then when was your last date of use for smoking weed?
It was probably about about 2 weeks ago.
Okay,
I would say I probably did my last hit.
of weed.
Yeah.
Okay, and then what other drugs have you done?
In
And
my
what
life.
age? Yeah.
By the time I was 12 and 13, we were taking acid and mushrooms, pills, anything basically like party drug stuff, anything we could get our hands on really, and smoking weed and drinking.
Okay, but then as far as the acid and stuff like that, when was the last time that you've used those like hallucination drugs?
It's been
It's
years.
been a long time.
Yeah, probably 20 years.
Okay, and then what about
15 years.
any other substances? Heroin?
There was heroin.
At what age did you start doing that?
I was 15.
And when was the last time?
A week ago. The day I came in here.
Heroin?
Yeah.
Fentanyl? So you're also on fentanyl?
Yeah,
Okay.
it was fentanyl.
And then when did you first start using cocaine?
I was 15. No, I might have been 14.
And then
I was 14. My older brothers were selling cocaine, and they would throw crack parties at the apartment. And I would run around on the floor picking up crumbs.
and then when was your last date of use for smoking crack?
Right about a week ago.
Okay. And any other substances? What about, have you ever been on maintenance?
I was on Suboxones for 8 years.
Okay, that was prescribed to you, or you were getting that?
I was getting it off the street.
Okay.
I used it for 8 years, and then
What age were you when you started Suboxone?
was I probably 29.
And your last date of use for that?
I'm gonna just say probably a year ago.
Okay.
The dates are getting all messed up in my head.
No, that's
It's
fine.
something like that.
And then if we can go over your history of treatment. How many times have you been in an inpatient treatment center for substance use or alcoholism? What was the most recent one before coming here? Prior to this, what was your most recent inpatient treatment center?
Probably a year before this.
And where was that?
In Baltimore.
Do you remember the name of the facility?
I do.
Okay.
It's called One Promise.
Okay. And did you complete that program?
I did. It was court ordered and I completed it.
Okay, and then prior to One Promise, were you in an inpatient substance, like a rehab at all?
I was in multiple over the past 10 years. I was in a place called Right Turn. I was in a place called Second
What
Genesis.
year was Right Turn?
2003.
And then did you complete that?
I did.
And how many days was that?
That was
30 days?
6 month.
6 months and you completed that?
Yes.
Okay, and then was there another one before a right turn?
Second Genesis.
And what year was that?
2002.
And how long was that program?
It was a 1-year program.
And you completed?
I did.
Did you stay clean after that?
No.
You ended up.
I ended up not using heroin or cocaine, but moving to alcohol and Suboxones and any other pills or stuff like that.
Okay, and was there any other substance use treatment centers other than the ones that you have named?
There was. I did 2 30-day stays at a place. I'm trying to remember the name. Oh, Hilltop Recovery.
And how long was that treatment?
30 days.
And you completed?
Yeah, twice, 2 times I was there.
So for the most part, when you do go into treatment, you're completing. You're not leaving early or...
Yeah.
Okay.
Yeah. I also did a mercy
Detox?
detox.
How many
And I did a
times have
baby-
you done that?
And I did a baby detox.
Okay. What year was that? Do you remember?
The baby detox was probably 2010, and the mercy detox was probably 2014. Yeah.
Okay. And what about, have you ever tried any support groups like AA or NA?
Yes.
Were you involved in the meetings? Like, did you have a home group and a sponsor? Or you just went for,
Yeah, I was introduced to it when I was really young, and I was just there, just to get a slip signed or whatever. I didn't get involved with the steps or a sponsor, and then I was court ordered again to do NA meetings, and I think that was the time I completed one promise, and I did get involved, and I had a sponsor, and I started working the steps, and I relapsed. And I was going to meetings, and I relapsed, and I just stopped everything.
did you find that the meetings were helpful when you were going and when you were involved?
They were helping out a lot. And everything was going good, and then my dad passed away, and when that happened, I just went off the rails.
It's understandable. Okay, so now we're gonna go ahead into your medical history. Do you have any medical high blood pressure? Do you have diabetes? Any
No, I have hepatitis C, and I was diagnosed with high blood pressure.
Have you had any treatments for the hepatitis C?
No.
Okay.
I have to follow up on it and get it.
And do you find that it's active right now? You can tell by like jaundice and stuff like that?
Yeah, I do need to speak to somebody because my liver's been hurting.
Okay. And then you mentioned high blood pressure? Or you might have
I was on high blood pressure, and I can't remember the name of the medication, but they put me on, I think it was some kind of blood thinners, or I can't remember what it was called.
Okay. Any other medical history?
No, I don't think so. I've had problems with my teeth my whole life, but just getting like abscesses in my mouth and battling with that my entire life.
Okay.
That's it.
And what about a mental health diagnosis? Have you ever been diagnosed with a mental health
Yes.
And what were you diagnosed with?
I was diagnosed with it was bipolar, anxiety, and depression.
Okay, and how long ago were you diagnosed with that?
It was a long time ago.
Do you see a counselor or therapist that would be prescribing you medications for those diagnoses?
I did. I was going to a place. It was called First Step Counseling, and I was seeing a counselor, and they prescribed me stuff, and I pretty much like ate it once and didn't like the way it made me feel, so I stopped eating it, and I just never ate it.
Okay. Do you find that your depression and anxiety has become maybe more intense with the drinking and drug use?
Yeah, I think it extremely intensifies it. I'm almost thinking it is induced by it, like drug-induced depression, drug-induced anxiety. I think I'm, pretty solid when I'm not using.
Okay. Have you ever been in a psych hospital for your mental health diagnosis? For the mental health, not for...
No.
Okay.
No.
And then any type of suicide attempts or suicidal thoughts, anything like that?
No, I mean, I've had suicidal thoughts, throughout my drug using.
But you never tried to
I've never tried to commit suicide.
Okay. And then no suicidal thoughts as of right now?
No.
Okay. All right, if we can go into your family history. I know you mentioned both of your parents were raising you at one point, and then
they got divorced.
Okay, and do you feel like your family is supportive of you getting help this time?
I do. I feel like my brothers and my mother, would all love to see me stop using.
And
my brothers use themselves, but my mother is there for me.
And what about substance use or alcoholism in either side of your family, like mom or dad's side?
It is.
On both sides, there's...
Yeah, there's alcoholism on both sides.
Okay. And what about I know you mentioned your brothers. Are they addicts as well?
Yeah, they are all three of them.
Okay.
Are addicts.
And then with your dad's medical history and alcoholism, what was his medical history? Diabetes?
He was a diabetic and a cardiac patient.
Okay. And then
heart disease.
What year did you say he was deceased?
In 2015.
Okay. And then your mom, does she have any major medical health issues?
She has rheumatoid arthritis, which in her older age is taking a serious toll on her.
And how would you say that your family upbringing or like your family history was growing up? Was there any type of trauma or abuse or neglect, anything along those lines within your family aspect?
There was all that, really. We were abused. Me and my brother were abused. We were neglected by my mother. She would be getting relationships with toxic men and bring them home, and they would beat us. I watched my older brothers do some real, messed up things in their addiction. We'd come home and all our shit would be gone, and they done stole it all to go get high. Yeah. So,
Do you feel like some of the trauma in your life has impacted the quality of your life?
yeah, I do.
And maybe that
You
can
know,
be addressed through therapy and counseling.
not to mention the trauma throughout all the years of using and being on the streets. And everything I've seen, people getting killed, people trying to kill me. There's a lot of trauma.
And your mom is supportive of you trying to get help, right?
She is.
She could be part of a support
You know,
network.
it took a while for her to get there because I put her through so much. But she is still there for me.
And are you single, married, divorced?
I'm single.
Okay. And do you have any children?
Two
Two.
little girls.
Okay. And
two daughters.
their names?
Kaylin and Quinn.
Okay. And their ages?
10 and 17.
Okay. And you said never married, single. And what about education? What was your highest level of education?
The 8th grade is the last grade I completed.
How many minutes are we at?
And
8th grade?
8th grade's the last grade I completed.
Okay.
But I went ahead to get my GED when I was locked up.
And any type of college or trade schools at all?
I went to welding school, trade school, and
Completed?
that. Yeah,
Okay.
I got my certification.
And what about your employment as of right now? Are you employed?
No, not now. Not with what's happened.
With your addiction?
Yeah, I was
And,
employed, but
what type of employment do you normally work for when you are working or able to work?
construction.
All construction?
Yep.
Okay.
Do
you feel like
pretty much anything.
your drug use and your alcoholism has it affected your ability to show up for work and to be?
Oh yeah, it completely destroyed it. I'm no longer employable. I was so strung out I couldn't go to work. I had to figure out a way to get high every day.
And what about, do you have any legal concerns right now? Do you have any open warrants or any open charges
Yeah.
or case?
Yeah. I
Okay.
got warrants in Pennsylvania and I got a couple in Arizona.
Okay.
Uh,
What is
I
your?
got the feds after me. There's a whole rack of legal things I got to get taken care of here. So I
Okay.
hope you or somebody can help me with this.
And we will be able to.
All right.
Are you? Is it violation of probation or what is the charges for?
Burglary and assault and
Failure to appears.
there's failure to appears, bench warrants for that.
Do you have any open court cases coming up?
I think I got one in November. I have to look, but I think there's one in November that I really had no intention on going to, but if I'm clean, I will.
Okay, and then are you on probation right now, or?
I think they violated me. I was on probation for a while
In what state?
in Maryland.
Okay. And then Pennsylvania, you said you have some charges, but that's not through probation.
No, neither is Arizona.
Okay.
It's just warrants.
Okay. How many times have you been arrested total, would you say?
I would say probably like 30 or between 30 and 40.
And do most of your arrests end up being incarceration, or sometimes it's?
It's escalated now at this point. These days, they usually just lock me up. But,
Okay.
you know, I did get some slaps on the wrist and probation and small sentences and like stuff like that, but they don't now. They don't do that anymore. They just lock me up.
Okay, and we'll be able, you know, now that you've admitted yourself in here, I'll set you up with like a case manager person to be able to address those open warrants and your legal concerns. And how would you say, how are you feeling about taking this step to try to get clean? Do you feel like you're motivated to do it this time?
I do.
Like, how are you feeling about?
I mean, I feel good. It's something that I want to do. I don't know. It's really difficult right now because of the detox and, you know, they got my medication all messed up.
And we'll make sure that's taken care of.
Well, I'm not getting enough is the problem.
Okay, so you can speak with nursing about that. We're not going to talk about this.
I need more medication.
Okay.
But yes, I am motivated and I do want to.
And you feel like you're taking this step for yourself. Nobody's, you know, pushing you to do it this time. You feel like.
Yeah, this is the first time I've ever done it
for
willingly. Yeah, voluntarily.
And what kind of things, like what does Joseph enjoy? Like, what are some goals and hobbies? Like, what brings you some type of fulfillment other than drinking and drugging?
My kids is probably the main thing, is trying to get things straightened out so that I can start seeing my kids again. And, I would like to continue my trade, my welding, and and just start doing the right thing.
Do you enjoy
get a job and get a place and you know all that stuff?
What about any hobbies or interests? Do you like being outside? Do you like fishing or hunting?
Yeah, I love the nature and being out in the woods and fishing, and I like working out.
And that's a good thing to do.
So yeah, you got a gym here?
Actually we do.
You do?
Yeah.
Okay.
That's good for your mental state too. Work out and get the endorphins and stuff going. I think that's all that I'm gonna need for our initial session. I'm gonna go ahead and get all this into the system, and I guess medical will be able to speak with you once you're done with me. All right, it was really nice meeting you, Joseph.
Nice to meet you.
Good luck with everything.
Thank you.
Okay. All right, see if it recorded. Remember last time? It stopped.